We are going to start here. Just click the button. Let you know when it's going live, okay? And it says we are live. Yeah, well, hey, we're going to go with it. We don't control the YouTube. Yeah, we're live. Everyone, we are here with Chris. And Chris is Overland Bound's medical advisor. We're very lucky to have him with us. And you've been, I know, Chris, you've been streaming some live stories on Instagram to answer people's questions.
Internet.
Oh.
Yeah, just a static picture, no video.
Well, it could be our internet. Okay.
Oh, no.
We are. There we go.
Maybe Rodrigo.
How's it going, Rodrigo?
How are we coming?
Coming through okay? Hey, how's it going? Harley. Okay. Okay, you guys. So we're just pausing a little bit here to make sure that our connection is good. Get some feedback from you guys. Let us know if you have any audio video issues. Looks like the internets are a little bit slow. Go figure. Everyone is at home and sheltering in place and watching content. That's the situation we're in. And I'll just start to reintroduce Chris. Chris is our guest today and done a few videos. He's our medical advisor and definitely has his finger on the pulse. I know you've done some live Instagrams to answer people's questions about some of the things that are going on. We had some feedback on the last video where people were saying, hey, why is it that Overland Bound is going to invest in? Aren't they about overlanding? But we have the resource and we have such a great relationship. We're glad to share. Really appreciate it. Chris, how are you doing, man?
I'm doing all right. We're more planning than dealing with cases right now, fortunately. So just the stress of making sure we're ready for everybody. But so far we're okay.
Great.
Yeah, I don't know if I'm supposed to, but I still can't see you guys.
We're being seen, Chris. So.
Okay.
We got a new mic in Brian.
Yeah.
Maybe we just need to sound.
Here we go.
Sound.
Okay.
How about that?
I mean, I hear you. I just don't see you, so it's fine.
Okay.
So Chris, what's the landscape like from your perspective? Why don't you do a little bit of an introduction and what your day by day has been over the last few days, and just before we get into some questions, tell people why you have perspective on this and what it is that you've been doing.
Okay, so some of you know I am a surgeon, trauma surgeon, chief of surgery, a few other titles, but also on the COVID strike team for my hospital and task force. Those are two separate things. Part of the task force is making sure we're prepared. Part of the strike team is if we have a surge, by being a critical care surgeon as well as with my anesthesia team, we will be the ones kind of going around and making sure that we can provide immediate airways and things for patients to allow the critical care docs to do the management and the ER docs to field the ER. So definitely am very involved in what goes on and trying to stay current and learn from everyone else that's been ahead of us. For us here in the Bay Area and most of California except for Los Angeles area, the shelter in place we think is helping a lot. We are behind where the projected numbers were supposed to be for cases, and some of that could just be from under testing. We all accept that, but we're not seeing the numbers in the ER and the hospital that we were expecting. So that's a very, very good thing, and we'll talk about that when we get into the details of stuff. But it gives us more opportunity to be prepared, but also to stay ahead and treat those that do come in. The climate, though, is not like that everywhere. Obviously, New York and New Jersey are taking horrible hits right now when it comes to number of cases, the number of sick people, and the decisions that have to be made by the care teams as to whether people get treatment or not, and if they're going to share a ventilator or not. And as you see in the news, the personal protective gear is gone for the most part. And yeah, you can improvise to some degree, but if you think about it, if you take out your healthcare team, not only were they already overwhelmed, but now their resources go down. And that's nurses, custodial, food services, lab services, that's everybody, pharmacy, not just the docs on the front line. So we're trying to avoid that here, but it's a big problem there. So we're scared, we're nervous because we don't want to get there. So the climate is still, even though we haven't seen it locally to us, there's a lot of big cities in the U.S. that are feeling it, and obviously globally, for everyone who's listening internationally, you guys are feeling it a little bit more than we are as kind of a nation. So that's kind of where we are. We're just still preparing, planning, and seeing what will happen.
We're on day 13. We're gonna have to leave. They're still having issues. We're on day 13 of shelter in place here in the Bay Area. So from your end of it, you're saying that for our region, we're not the impact hasn't what they thought was going to be happening hasn't happened. Is it hasn't happened yet and it's still coming? Or does that make sense?
Yeah, so we don't know. Predictive models are best case, number, mathematical, whichever way you want to look at it. So we don't really know yet. Obviously, we're looking at 14-day incubation periods. For some people, majority of people are 5 to 6 days, but 14 days is not outside of the realm of possible for people to develop symptoms. So the fact that we've been on shelter in place for 2 weeks means we could just be catching sort of some of those people who didn't really shelter down early. But we're kind of thinking if we're going to get a big surge locally here, it's going to be in the next week or two, just because of where we are on the curve. But the more we stay away from each other, the more we shelter in place, the more we do the hand washing and the good hygiene and only do essential things, the more likely that our curve will continue to stay flat. And the importance of that is just, it's really not just to keep the number of cases down, but to minimize how many people show up at the ER at once. And I'll just jump into that because that was one of the topics. You guys hear flatten the curve. And if you don't understand what that means, we only have the capacity to deal with a certain number of patients at once. And then we have less capacity to deal with very sick patients at that time. So if you want numbers, my hospital has 16 ventilators outside the operating room. We have 4 ventilators in the operating room, but we only have a total of 18 ventilators available to sick patients because we must maintain 2 to keep our operating room going on limited capacity. What that means is the first 18 people who need to be on a ventilator or breathing machine get it. Number 19, we have to make a tough choice. Do we pull somebody off? Do we try to split a ventilator, which is not safe and very tricky to do? And or do we just not care for number 19? So as you can see, our hospital is 155 beds. It's not very small. It's a good-sized community hospital, but it's only going to take 18, 19 patients to overwhelm us if they need a ventilator. So that's why the shelter in place has to be you just have to stay away from each other and respect it. So.
Yeah. We have a question. Hey, Lucy. Lucy asking, virus only transmits membrane, or can it on?
So, I mean, it's a good question because there's a lot of confusion about what's out there. Is it aerosolized? Is it just airborne? Is it droplet? Is it whatever? So right now, we're thinking it is just droplet, which is respiratory, and it has to enter your respiratory system to affect you because that's where it takes hold. Getting it in your bloodstream through a cut it doesn't end up in the respiratory system where it takes hold and causes the inflammation and the problems with the oxygen going back and forth in something called acute respiratory distress syndrome, or ARDS, as you guys will hear. So it's less likely, but we don't have enough experience with it to say yes or no for certain. But if you look at it compared to other viruses that are similar to it, it's less likely that a cut will cause a problem. Same thing with going out in public. If you're walking around, it's less likely that just being in the air is the problem. It's really the respiratory droplets. So that's close proximity to other infected people and then getting droplets into your respiratory tract. So that can enter through your nose or your mouth.
They still can't. Hey guys, can we do a sound test really quick? Can you quickly tell me if talking this close to the microphone works?
So
They can't hear it. Okay, we have to be.
I think okay. They're saying it's quiet.
No, they're saying can't. So
Yeah, but
here we go.
Yeah. So, Chris, a question from a very ignorant perspective, which is mine. So, okay, so we shelter in place, we flatten the curve. How do we get beyond the virus? Like, how do we? So, say we do flatten the curve, and then somebody goes out, reintroduces, and exposes the population to the virus, and then we're back where we started. Clearly, it's very, it spreads quickly. How do we get beyond this?
So it's not an ignorant question. It's actually a great question.
Hey, Chris,
and
can you repeat the question too before answering?
Yeah. Okay. So the question is, how do we get past the virus? If we shelter in place, how long, basically, and then what happens if we go out and we spread the virus again? How do we get past all this? Is the short version of it, and it's a great question. It's actually one that's been asked of a lot of experts, including Dr. Fauci, who is, in my opinion, the true expert on what we're doing here. He's the guy in charge of all of this. We don't have a good answer. The virus is going to tell us when, is his answer, basically, and that's, I agree with, not that I'm the expert in it, but I agree with that. We will need to get through the immediate phase, which is now. That's limit the amount of people who are exposed, limit the amount of people who become serious and require hospitalization, and limit the death from this. That's kind of where we're at right now. Eventually, we will see a point where the number of new cases drops off to some minuscule number that's considered acceptable to consider reintroducing people to society, if you will. South Korea is a good example of why we don't know all of what's going on. They're a country who didn't do it right away, but then did it really well and had the lowest incidence of new cases as a nation. And they didn't end up locking everybody down because they tested everybody, and it was great. But now as they've started to reintroduce more people to society, they're seeing the numbers go back up, and they're having to go back to shelter in place. So the reality is we don't have a good answer. It's going to be months before things are normal, maybe 3, 4, 5, 6 months. I don't know if we'll be in shelter in place through all that time, or if people will be able to be reintroduced with tracking. But until we get that herd immunity we talked about last time, which is enough people who have had it to kind of have some basic immunity to it where it's not as miserable and life-threatening, and a vaccine, which is probably a year away, from according to all the experts. So this is going to change life for a while.
There's a question out in Arizona, and it's from Desert Tramp. Hey, Doc, out here in Arizona, any truth that when it gets warmer and drier that it might go slow or stop it?
There's a little bit. It's like all viruses. They're if you consider droplets, they need humidity in the air, and cooler weather to some degree helps them. Also, in colder weather, people tend to have more mucousy stuff, and once you get into more warm, dry climates, it's a lot harder for the virus to just survive in general. So there is some truth to that. What that means for this virus, we don't exactly know. It's too new. We haven't seen the seasonal cycles yet. So we're hoping, which is kind of most of therapies right now is hoping something works, but it's too soon in the virus cycle for us to really have an answer.
Now, another part of the too soon in the virus cycle, Ofer is asking, can people get it twice?
Yeah, people can get it twice. There's a few reported cases of people who were positive, considered cured, healthy, and then sick again. I'll be honest, I haven't had time to catch up on the exact if they tested negative, 2 times and then tested positive, which is kind of what we're looking at. If you have test negative twice, then you're okay. But I have read that there are people who have been considered to have had it twice now.
And you guys, please feel free to put your questions in chat. And I'm all caught up. And sorry about all this sound. We're always
there's also a couple of comments about things never going back to normal. And certainly I think the magnitude of what we're dealing with will certainly change our perspective for a long time to come.
Absolutely. I don't. I actually, personal opinion here, but I hope it does. I think that this will hopefully change things for the better overall as a society. But when it comes to what's going on, the thought in the medical and immunology profession is that this is going to be cyclical, like the flu, like cold, and so we'll have seasons. And depending on how much of a grasp we can get on it, like the flu, we have a shot. We've learned how to stay a little bit ahead of it and to minimize its death. But until we can get a handle of it, there may be kind of seasonal shelter in place during the COVID season.
This is a good. I got your question, Antonio. Do places that have low numbers not phrase this right? Do places that have low numbers, do they not have to shelter in place? A lot of my friends up north in Bakersfield, not pointing fingers, but they just happen to be in Bakersfield, believe that since cases and deaths are so low, the city does not need to follow the orders.
So I 100% disagree with that for a lot of reasons. One, unless you've tested every person in that community and prevent people from coming and going into that community, you can't say what your actual positive rate is. Whether they have symptoms or not is a whole nother conversation. But knowing that this disease is serious, it is affecting all age groups, not just the elderly, and we have no treatment for it, and it's spread by basically being around other people, and asymptomatic people who have no symptoms are considered to be one of the biggest threats to transmission. Unless you have tested everybody in that population to know that every single person is negative, you have to do the shelter in place and social distancing. And just real quick, we all say social distancing because that's what's gotten into the news. We're trying to change that to physical distancing because you really don't want to socially distance. You don't want to stop talking to people. You guys are putting video out for people to talk to. We're all doing live stuff because we can't see people in person. So we really want to focus more on calling physical distancing, because if you call it social distancing, that's basically being a hermit up on a hill. And as much as most of us Overlanders like to get out in the middle of nowhere and enjoy nature, you don't want to socially distance. You want to physically distance.
Okay, here's a good question. Do we need to clean our camping gear differently? This is James Stein asking. Do we need to rethink how we clean our gear?
I don't think so. If you pack your gear at home, relatively safe environment, you're not supposed to be going anywhere, but if you're in a place that's not shelter in place and you go out into nature and then you come back and you don't have any contact with other people, it's unlikely to end up on your gear. And it only really, in the news, you're going to see it's going to survive on surfaces for 3 or 4 days. And I think we covered this last time, but we don't know if it's still infectious at 3 or 4 days. Right now, we don't have enough studies to say how long it stays infectious. We just know that it's present on surfaces 3 or 4 days later. And one of the things Corey brought up right before we jumped on was the Princess Cruise that's talking about, 17 days after passengers got off, they found the COVID-19 virus. That is a sensationalized news headline. True, cannot argue with the truth of it, but if you read it, what they found is the RNA. It's their virus equivalent of DNA. We have DNA and RNA. RNA is the genetic material that makes up the virus. They didn't find whole viral particles. They found parts of it. It would be, and Corey made the analogy, so I'm going to give her credit, it'd be akin to finding a skeleton. Yeah, you found the bones of a body, but you didn't find the body, and it can't do anything. So, if you were to go out and it got on your gear and it stayed in your closet for a month, it's not going to be there anymore. So, no, I don't think you need to clean your gear differently.
Hey, really quick, Roller Angels wanting to, can you talk about symptoms? Just give a refresher course on what to pay attention to.
Yeah, of course. So the symptoms, unfortunately, really overlap with a lot of the other ones, flu and allergies. But you're looking for fevers. We define that as anything over 100.5 Fahrenheit. Sorry, I don't remember the Celsius conversion right now. It's been a long week, as you can tell, the hair and the eyes. And I don't even know when the last time I shaved. But hang on, it'll come back to me. You guys, it's a long week. No, I forgot. What was it? Symptoms. Sorry, it was there. It's been a very long week. So, dry cough, sore throat, maybe plus minus, fever. Those are kind of it. Even if you had flu-like symptoms, we probably wouldn't test you. Really, the thing to worry about is respiratory problems, shortness of breath. If you're having a hard time catching your breath, it still could be flu, but it's more likely that you need to be worried about the COVID-19, and that would be a good time to go to the emergency room. If you think we have time, I can give a 3-minute how it kind of works and how it kills, and that might help with symptoms.
Yes.
Okay. So the way the virus works is it goes down into your lungs as you breathe it in, and you have these little pockets called alveoli. And in the alveoli, they actually stick to the lining and start to affect something called a pneumocyte, which is the actual cells of the alveoli. And if you can imagine, the way it works, you have very microscopically thin tissue. You have air pocket in the alveoli, and then you have blood. And oxygen goes in to the blood, and carbon dioxide comes out, and you breathe it out. That's basic physiology. This starts to disrupt that distance, so that distance becomes bigger. And we can get into the details if you want to message me offline. I'd be happy to give you a 30-minute explanation about it. But once that distance gets bigger, the ability for oxygen to get into your blood decreases, and the ability for the CO2 to come out decreases. And as it continues to get bigger, your lungs get stiff. So instead of being able to take a nice big breath, can't move them very much. So between the inability to move oxygen in and the inability to compensate by taking a big breath, you actually deplete your body of oxygen, and it's the same as suffocating. So what's going on with these people, without being too grim, is they are basically starting to suffocate. And when we put a breathing tube in, we can overcome some of that. But we can't always overcome all of that. So this is where it becomes very problematic, because there's no medicine. There's just mechanical breathing to try and overcome the physics of how oxygen gets into the body. So that's how it kills. And the fevers are a symptom of that. They're a symptom of just being infected. And the shortness of breath is a sign that you've got some problems inside your lungs. So those are the two to really worry about and keep track of.
And OTH Overland, physical distancing is a far better term for it, by the way. Agreed. Very much agreed.
Not mine. Can't take credit, but I do like it.
Yeah. Hey, Rodrigo wants to know, as we all know, we can't find wipes and alcohol disinfectant. Does the solution of 1 to 10 bleach work?
Absolutely. Yeah, 1 to 10 bleach is perfectly fine. This is not a super virus. All right, let's be clear on what this thing is. It's a basic virus. The problem is we don't have any natural immunity to it because we haven't seen it before. That's why they sometimes put the word novel in front of corona or COVID. It's just new to humans. We don't have a natural immunity. And then two, how it works, which we just went over. But when it comes to being a virus, it's not particularly complicated. So whether you've got a 10% bleach solution, which is excellent, I saw it online, so I don't know where I got credit from. So if it's your idea, please just go ahead and let us know. Take a rag, put it in a mason jar with a 10% bleach solution, and that will kind of allow you to use that rag, wring it out, wash it out, dip it back in, instead of wasting supplies. I think that's very reasonable. We covered it last time, but 10%, no more, no less. And there's a chemistry reason for that. Once you get above 10%, the bleach actually forms a protective layer around the virus instead of killing the virus. And what you're doing is taking away the fat layer that the virus has out on the outside of it as a protective armor and kills it. So bleach, regular, you don't need alcohol wipes. You can just use 409 or whatever your cleaning solution is of your choice. Anything you would normally clean your kitchen counters with is effective against this.
Okay, and we had that discussion about soap and how the magic of soap is that it does the same thing. It just takes that barrier down.
Yeah.
Okay.
Yeah, and you need 20 seconds because you just won't get to all the surfaces with enough time to allow it to work. The more suds, the better. The more likely to disrupt the viral particles, the more likely to loosen them from your skin, and then you just wash them down the drain.
There was a question earlier, Chris. Someone said, hey, I've heard there are 7 to 8 strains of this virus. I think that the concern there is how many enemies are we dealing with? What's your response to that?
That's correct. There's 8 different strains circling the globe right now. Again, not incorrect, but we don't know the clinical impact right now. What that means is they're all slightly different, but all close enough. It's equivalent to a different color car of the same model. They're all a little bit different. Can't say they're exactly the same. Does it affect their performance? Maybe. We all know that sand glow cars go slower than everybody else. That's the Camel Trophy color. And that white cars go faster, right? We all know that. We don't know. That's the answer. But there are 8 strains. We just don't know what their clinical implications are.
Okay, so sorry, just for me to run that back. So there's 8 different strains that are known, correct?
Yeah. Yes.
Now, what does that mean in the development of a vaccine?
Not a whole lot. The same reason you got to get a flu shot every year. There's lots of strains of flu going around. We do, they call it predictive DNA or RNA analysis, where they predict how the changes will occur for the next cycle of it so that your vaccine actually can compensate for it. So once we know, it's actually good for us to know that there's 8 different strains right now because we can start to see how it changes and make those predictive models so that when we do develop a vaccine, it'll cover 1 through 8 and then hopefully 9, 10, 11 or whatever they can get to for the predictive part of it. But it's it doesn't usually mean a whole lot in the long term of it.
Jeremy has a question. Hey doc, people are starting to shave their beard in Europe. Beard may keep germs around and also does not help fitting an N95 mask properly if you have one. What's your take on this?
Both are 100% true. Don't let this fool you. This is actually 3 days of growth. I know when I shaved because I was at work last. I'm just hairy. But yeah, N95 masks are not certified to fit if you have facial hair. And CDC for us CDC in America and most people, the respiratory droplets will stick to your facial hair. And most people don't wash their face as much as they wash their hands. So unless you want to wash your face every time you wash your hands, you should absolutely shave. And even if you wanted to, I personally wouldn't want this viral particle trapped anywhere near my mouth and nose longer than it needed to be. So I haven't left the house in 2 days. I've been fortunate enough to be home and do administrative work. But if I were to go out, I think I have to go shopping for the family tomorrow. I've taken on the the hit there. But I will, the tribute, that's what I am. They call me the tribute, like from Hunger Games, because I go out for everybody. But I'll shave before I go out because I don't want to bring it home, and I will shave when I go to work. So, shave.
Copy that. Simple green work.
It should. It should work fine.
There you go, Justin. Okay, some more. Oh, Robert, Dragon Riders travel. This is a good one to circle back to. As I may recall, your immune system is affected with the COVID-19. As Corey and myself are in with immune downgrading medication, could this be a benefit or just an extra danger?
I mean, it's an extra danger. It's one of these catch-22s, unfortunately. It's part of the immune response that causes the problems. But if your immune system is compromised, then the virus is allowed to have more of its response without the body putting it in check. And this is why the elderly and the immunocompromised, and they define that as people starting with having even diabetes as immunocompromised, will have a harder time fighting it. And the more of your lungs this virus takes over unchecked, the more likely you are to go into that ARDS we talked about earlier, which is very difficult to treat for us normally. And that's when we have one patient maybe every 3 to 5 months that we have to deal with. At my hospital, bigger hospitals have one patient probably all the time, but it's a very difficult situation to treat. If you imagine we can't get oxygen into you, you're not going to do well. So having a compromised immune system is absolutely going to put you at a higher risk of having a worse outcome than somebody without a compromised immune system.
That's the reality I live, for sure. And Robert, good to see you on here, man. And we had talked about this earlier, Chris. Okay, here we go. Sounds like there's a need, or at least a best practice, to wipe down groceries and packages before bringing them into a home. But also how that relates to delivery, takeout, all those things.
So, excellent question. And as Corey said the last time, if I don't know something, I'll admit to it, and then I'll go look it up. So I looked it up last time, and a virologist from UC Davis, University of California, Davis here, Dr. Erin DiCaprio, did a whole thing on this. She actually studies community foodborne packaging type of viral delivery and viral loads. Here's what she has to say. Most likely, if you talk about packaging at a store, you're okay. If you really want to wipe it down, that is your business. But again, we are talking about respiratory droplets that have to get into your body. Now, there is another virologist out there who's telling everybody they got to wipe everything down and leave it outside for 3 days. So I will tell you there's two sides to this story, and you can pick which one you're most comfortable with. I'm going to tell you what I do and what I'm comfortable with based on the recommendations of Dr. DiCaprio here. So if you look at a respiratory droplet, if I were to go to the store and buy a package of food and bring it home, the droplets may or may not be on that bag, but let's say they are. If I'm in the store and I pick it up and I put it in my cart and I go about my business and I check out and I put it in my cart and I hand sanitize, now they're not on my hands, which means they're not on my face because I don't touch my face. When I get home, I will put all those away and I will wash my hands again and wipe down the counter that I had them on. By the time you get to them, the particles are probably not infectious. That is where I'm going with. The other thing she said is takeout food. Now, we've just decided in my family we're not going to do takeout for now. As you said last time, I'm buying gift certificates at restaurants I would go to support them. But takeout food is the same concept. Respiratory. Putting it in your mouth and eating it does not immediately confirm that you will get it into your respiratory tract. So the recommendation, if you get takeout, is to take the food out of its packaging, take the food out of whatever it came in and put it on a plate. Throw the packaging away, wipe the counter down, wash your hands, and then you can eat the food. So that's reasonable and I don't think there's a problem with it. We just decided because I have a higher risk just by having to go to work that we're not going to take any extra chances in my family. So we're not doing any takeout right now. But I don't think it's unreasonable or unsafe to do takeout as long as you follow those precautions. And the last one, cardboard boxes, deliveries. If you're super worried, open the box outside, bring in the stuff inside, throw the box away, wash your hands. If you do bring the box inside, just wipe down whatever it touches.
Now, this was in the news cycle. This gem. Here we go. I do not know how to pronounce these names. All I know is Plaquenil. And Robert's bringing up, what are the results of the two medicines, Plaquenil,
Chloroquine and hydroxychloroquine.
Yeah. Are there valid results yet?
No. There's no valid studies to say that those make a difference. It's purely anecdotal. When this first hit, we had nothing. We still have nothing. So people were throwing anything that made sense out there. Malaria is a virus. Antimalarials, we gave it a shot. Some people got better and it made the news. But there's no study that says that it's good. There's no scientifically proven benefit to taking them. Are we still prescribing them to certain people? Yes. We have nothing else. Same reason why we're putting 2-3 patients on a ventilator in some places, because we just don't have anything else. Is that good science? No. Is it going to turn out to work out? Probably not. But the alternative is just saying you're going to die today. And that's not what any of us in healthcare went into it for. So we're trying. But no, those two drugs have not been scientifically proven to make a benefit and change outcomes.
Right. Then leading into another question from 94 Discovery, does taking high doses of vitamin C help?
Probably to a point. As we covered last time, vitamin C is cleared by your kidneys. So as soon as you reach maximal absorption for your body, you're going to pee out everything else. Most people, anything over 1,000% of a daily recommended daily intake is just peed out and wasted. So if you want to talk high dose, take your 1,000%. I forget what the international units are, milligram wise, or off the top of my head, but you can. It's not doesn't hurt anything. It just don't take too much.
Good question here. How can we preliminarily, this is from Kevin Dawson, how can we preliminarily strengthen our lungs? Is there a breathing exercise? Is that something you can do preventatively?
No, unfortunately, no. It really has the only thing that might work, and this is just me kind of talking about physiology as I understand it, is if you had better lung capacity, if you were like a super athlete or something. But the truth is, it's a percentage of your lungs affected compared to its capacity that causes the problem. If you've got poor lungs, 5% may be enough to put you into the point where you can't breathe anymore. If you've got good lungs, it may take 50%. But that doesn't mean you won't get 50%. It just means it takes more. There's really nothing that you can make a difference in the short term to improve lung capacity unless you were to go out and really start training at elevation or long distance aerobic exercises, cycling, running, things like that, to improve lung capacity. But that takes weeks. So if you want to start now, sure, but it won't change in the short term.
If you recover, are there long-term effects?
So again, we haven't seen this virus long enough to truly know the answer to if there's long-term effects. But what we have seen in people who have recovered is that some of them have a 20 to 30% reduction in lung capacity. So that means that what you used to be able to do without getting short of breath, maybe it took you 5 flights of stairs to before you started getting winded. Now it's going to take you 4 flights of stairs or 3 flights of stairs before you get winded. So we are seeing that in some patients, and there's been no reports of any improvement in that. I don't know if there will be, because when it affects your lungs, it creates fibrosis or scarring. Scarring doesn't go away. So it's most likely that whatever effect you have, if you have this, will be permanent.
We're going to circle back to this one too. This is the ibuprofen. Ibuprofen. Terrible pronunciation. What is the deal with a virus feeding on ibuprofen? If I take a medication that has it as a base, should I stop taking it?
Yeah, again, a lot of confusion, and that's actually no one's fault. That's not the media's fault. That's not politicians' fault. There was concern, again, anecdotal, that people that were given ibuprofen and the thought of reducing the inflammatory response seemed to do worse with this virus. So then the alarms were sounded, and the bells were rung, and we all said stop giving people ibuprofen. Everybody stopped taking any anti-inflammatory. But then as they looked into that, there was nothing to really support that on the whole. So even the World Health Organization said stop taking ibuprofen for a while, but now we're back to ibuprofen is okay. So if you need to take ibuprofen, take it.
Oh, I had this question too. Zinc supplement. Zinc lozenges. How did it go?
So zinc is one of those ones where a lot of people believe in it. They believe that it just helps the immune system. It helps kind of break down the viral particle in the back of your throat and helps actually strengthen the cells that are there. Okay. Not going to tell you not to on that one. There's no science to say that it's better. There's no science to say that it's worse. If it makes you feel better, that counts for a lot in my opinion. So go for it.
What else was on your Jared DeRosa says Chris for president?
I don't know about that. I got a list too.
Yeah,
so
why don't you hit some of your list?
Yeah, okay. Let's see here. We covered ibuprofen. We covered food. Oh, gloves. Wearing gloves. Something I do see, and has been pointed out on social media, the general population doesn't seem to understand the concept of what gloves are for and how to use them properly. And that's not being mean. That's just a factual statement. If you wear gloves and you get in your car and you drive your car, and then you get out and you go to the store and you touch the shopping cart, and then you touch the groceries, and then you handle your money, your credit card, and then you put all your groceries back, and then you touch your steering wheel again, and then you scratch your nose, that viral particle has been there the whole time. So if you're going to wear gloves, understand their limitations and their proper usages. So if you're in your car, there's probably no viruses in your car because you are the kind of person, if you're wearing gloves, have wiped it down. So you don't need gloves. If you want to wear gloves in the store, great. Touch the shopping cart, wear the gloves, do all your things shopping-wise. Take them off when you get back in your car and hand sanitize. And don't touch your face with the gloves. So gloves is one thing that I think people get wrong. I don't wear gloves when I go out in public. I'm not particularly worried about it. I touch surfaces, I get my stuff, I hand sanitize, and call it a day. So that's the thing on gloves. Just interrupt me if another question came up.
Just a quick, is the CDC the website you recommend for valid information for both accuracy and being current?
Yeah, so far the CDC website seems to be pretty good and stay accurate. Like I said, if you really want to hear it from the true expert, go find Dr. Fauci, any interview with him, Fauci. And I'm going to say this, and you guys, I think, trust me at this point, I'm going to say this with a non-political bias. Any interview where he is alone, you're going to get better information. I listen to him, and I'm not promoting the show or the politics that go on with the show, but Trevor Noah from The Daily Show interviewed Dr. Fauci and asked excellent questions and got excellent answers based on science. It's a 12-minute watch. There's not really any politics in there. So if you really want just solid answers, that is a 12-minute that answers everything for you. So there you go. But that's what I would, those two things, CDC and Dr. Fauci. Let's see. Put it in perspective for you guys. This is from Dr. Fauci. Flu has like a 0.1% transmission and kind of rate. COVID's 10% or 1%, tenfold increase. So flu is 0.1% transmission. COVID is 1%. That's a tenfold increase. That's why it's way worse than flu. But I think that's it. You guys have asked some really good questions. That's actually everything on my list. What else we got?
Let's see. It goes into Graham asks a comment and a question. Here in Santa Clara County, we've been isolating and social distancing for more than 2 weeks. If there is no widespread testing, how do we measure if we are flattening the curve? Thanks for doing this.
Excellent question. The answer comes down to the number of patients admitted to the hospital who have symptoms and are tested there. So if you look at countries that tested everybody, they have a very high testing rate and a very low positive rate. South Korea, last I heard, was 1% positive, which means they tested everybody. But if you come to the hospital where we have limited resources and we're not testing the entire country, we're going to have a very high test to positive ratio because we're testing people who are already symptomatic. So I wouldn't worry so much about the number of tests. Ideally, we want to test everybody so we have an idea if we're truly keeping those numbers low. But since we can't test everybody and it's already been 2 weeks, look at the number of cases that are positive because those have to be reported to county health and up to state health. So all that data is there. And if you've looked at our curve, and I don't remember off the top of my head, I had it somewhere, but our curve has definitely flattened from where we thought we were going to be if we stayed in Italy's footsteps, which we haven't done. So I think, like I said earlier, that we are really doing the right thing and keeping this where it is. But honestly, it's going to take another 1 to 3 weeks for us to know for sure.
Okay, Ofer has a question again. In your opinion, what is the end game? Worst and best case?
So worst case, we'll start there because that's worst case is this is how we are for 6 to 12 months. Physical distancing. I have to practice myself. Physical distancing, where you know, it's not going to be, it won't be quite Hunger Games. Our food supply will be there, but it may be you shop on Mondays and the person next door shops on Tuesdays, like garbage day. Everybody gets a different day to go in to keep people from showing up at the same place. Large gatherings may not be allowed to occur. And we're talking worst case here. It may be that everybody has to get tested often and walk around with the negative card to show that you can be out and about. I don't really know. There's a lot of really worst case, but if this continues before we get a vaccine and get a hold of it, which it's a year before a vaccine, and then if you think about how many people have to get a vaccine before it becomes really beneficial, this could be, this could just change humanity for a year or two. So that's worst case, and that's super Debbie Downer. I get it. Best case scenario is next 3 to 4 months, we really change our ways and accept the difference in our ways, and the numbers flatten out, and the warmer weather comes, and the hope that the warmer weather makes a difference all come true, and we can go back to some normalcy in the next 3 to 6 months and get vaccines out there. And now that we know it's a problem, private entities, scientific communities will be working to kind of get a hold of this, because this, like I said, the odds are by the time this initial rush is over, every person on this earth will either directly know or once removed know somebody affected by this disease directly, whether the loss of a loved one or just being sick with it. Like, those are the numbers we're expecting to see. So best case is in 6 months, everything's kind of back to normal-ish, and in a year and a half, completely normal, in my opinion.
And Brian Schwari, I'm going to agree with it. I'm just going to say yes. Do you think we should all act like we have the virus at this time? Yes.
Yes. And the reason is, I'll post it on my Instagram, but maybe I can make it work here. There's a good video. I forget where I stole it from, and you guys know I'll give credit when I do the things. But the way it works, if you look at exponentialness, if I don't feel sick, but I go to see my parents may become infected because I didn't know, and they're in their 70s, and then they die of it, and they die of something I gave them. So there's the psychology of that alone. But we don't know who has it, and it's not the sick that do it. Let's see if this is going to work. So this video shows exponential growth, and what happens if one person stays home, doesn't go do the flight, doesn't go shopping. I don't know if you guys can see all that.
Yeah.
Okay, so slow-mo that, do whatever you want to do, direct message me. I'm going to post it probably tomorrow, but that is the best example of why you have to just assume you have it and stay home. One person could literally save the life of thousands of people if you were positive and prevented it from being transmitted.
And that's on your Instagram.
It will be. I haven't posted it yet. It'll probably be tomorrow.
Cool. And Chris's Instagram is overlandbound.md. He's on there often. He's putting up information. He's going live. I highly recommend following him.
And actually, so technically, I don't have to go back to work till Thursday. So I'm going to hopefully recover as long as we don't have a surge. I have a lot of administrative preparation to do. But if you've got questions, I'm home and I'll be answering them. Direct message me. Like I said, I really don't mind answering questions. To me, the more people understand the reality of what we're facing and get it, and I don't politicize it. It's not scare tactics. The more you understand the reality of it, the better we will all be, because this is the only time in my life and in my parents' life and my grandparents' life that it is we, not me, globally. And that phrase has to take off. We, not me.
Okay. Justin Young has commented, his Lowe's store is using 2/3 bleach solution. How you would approach that? Tell them they're doing it wrong?
Tell them to direct message me, and what I will do is, I actually just tell you myself, direct message me on Instagram. I'll send you the link on the chemistry behind why 10% is better than everything else.
Okay, cool. And Justin, yeah, Simple Green cleaners, right? Just household cleaners.
It's not a super virus when it comes to it's a normal everyday virus. To be honest, if you leave it out and stare at it long enough, it will die. Okay? It's not a super virus. We don't have immunity once it gets into our lungs, and therefore it's dangerous for us. But killing it, easy to kill it outside of the human body. So yeah, anything. Simple Green, 409, Windex, I don't even know what else is out there. Anything that's a normal degreaser cleaner will kill it.
Cool. Hey, good question here. Do inhalers help if you're already using them?
I don't know if we've directly looked at the preventative nature of an inhaler. Obviously, if you are using an inhaler, is to help improve your lung capacity for whatever disease you're using it for. So continue to use it, because if you get it, you want your maximal lung capacity at the time you get it. But I don't think we have any evidence that an inhaler is protective in any way.
Chris, thank you again.
To wrap up. It's been an hour.
Yeah, and
it's been an hour?
Yeah.
Wow.
Said we, not me.
We, not me.
Yeah, that's right. And so now we're practicing physical distancing. Acknowledge it's a we, not me situation. And Chris, thank you again. You guys, we've said it a number of times. Overlandbound.md if you have specific questions. And thank you for being here with us tonight, everybody, and Chris.
Yeah.
Then we will be posting this up. It'll be available. We'll keep keep it going. Our content. Pandemic 2020. We're putting information like this up as much as possible. And there's just a bunch of thanks coming in from people.
Yeah, lots of thanks, Chris.
Yeah.
You guys, you can post
Happy
in
to help.
the video. It takes a little while to process, but once it's live, you guys, everyone, if you have any questions we didn't get to, post them in the comments, and we'll try and forward them to Chris. Chris is busy, but he's answering questions. Try and get them to Chris. All right, we're going to wrap up here, guys. Thank you very much.